All right, we're going to talk a little this morning about needle deflation. It's a hot topic that hits my website frequently. I've seen patients come down all the way from Orlando to see me for a needle deflation. What is a needle deflation? So women that have saline implants, over time, the saline implants can deflate themselves. There's a rupture rate. Instance that's about 10% at 10 years, and then it goes up 1% every year after that. So unfortunately for some women that either have a traumatic accident or the implant just fails, one side can deflate. So needle deflation would be if that patient isn't sure what they want to do, we can simply use some Novocaine, numb up part of the breast, stick a needle, insert a needle into the breast implant from the outside, and deflate the breast implant so that the woman can appear appropriate in clothing. It's not a long-term solution, it's a short-term solution. Ultimately, something needs to happen to those prosthetics that are inside of the chest. They either need to get removed completely or just swapped out for new implants, but something else has to happen. That's not the end procedure. It is a temporary thing. The other patient population that I use needle deflation on is some women that have had breast implants for 15, 20 years that are now in their 50s are trying to decide whether they want to continue to live with breast implants. However, over time, they've also forgot how little natural breast tissue they have. So in some of those patients, what I will do is I will needle deflate both sides. They will then see what they're left with having the plan to have a breast lift or mastopexy with or without implant replacement, typically smaller implants, in a surgical procedure soon after the needle deflation. So it gives them an opportunity to decide whether they really want the added breast volume of the implant or they need it, more likely, whether they need it or not. So that's needle deflation.